It's a change years in the making. We talk with Collin Wiant's mother the day the law named after her son went into effect. Plus, lawmakers get fired up over a COVID-19 vaccine mandate bill. And new data is available on the state's COVID-19 dashboard. We'll explain what's different about the way the state tracks cases. Thank you for joining us for Face the State. I'm Kevin Landers. Tracy Townsend has the morning off. Collin's law went into effect in the state of Ohio this week. It makes hazing a felony and holds universities accountable. The law has been years in the making. 10 TV's Brittany Bailey has been tracking its progress.
For the mother of Collin Wiant, all roads have been leading here since November 12, 2018. That's the day Collin died after a hazing incident at Ohio University.
Painful, unexpected, long.
It would be more than 2 years later before the law bearing her son's name was introduced again in the state legislature, another 4 months before it was signed, and 3 more before it finally became law.
Today I woke up not knowing how I would feel today, and I was surprised that today I woke up really happy and joyful about this. I just keep thinking that if Collin had received education on hazing that students now will be receiving because of Collin's law, that he would be alive today.
It all comes after another Ohio college student, Stone Foltz, died after a hazing incident at Bowling Green State University. Supporters of this law hope his death will be the last.
Some people have said that, hazing is a long time tradition. And I think today, with all due respect, that tradition ends.
There really cannot be any tolerance for hazing. Anybody who's associated with hazing needs to be off the campus. Gone.
Collin's law makes hazing a felony and failure to report a misdemeanor. Colleges and universities must provide anti-hazing education and training and be transparent about any hazing that does happen.
While other states have, felony penalties relating to hazing, I'm not sure that any of them have quite the breadth of the education, training, awareness, expectations, responsibilities associated with college life.
For Kathleen Wiant, the journey certainly doesn't end here. She's already lobbying on Capitol Hill for a federal law.
It's all I have to do. It's the most important thing I have to do. So yes, I won't give up on that. I'll be working on that till the day I die for sure.
Brittany Bailey, 10 TV News.
The higher ed plan for schools in our state is pretty comprehensive. If you'd like to read more about it, we'll link you to the info on 10tv.com. The Vaccine Fairness Act drew quite the reaction at the State House this week. House Bill 435 would allow more vaccine exemptions for employees in both public and private sectors. The bill is designed to help hospitals and businesses mandate shots while also allowing those who want their medical freedom to choose not to get it. As you're about to hear, lawmakers looked to a local doctor for answers, and some didn't like what they heard.
Pregnant women, a nursing mother should be vaccinated.
Inside the State House hearing room,
we are talking about a bill that lets people make a decision for themselves.
A local doctor did his best to swat away the disinformation.
Just because something was reported in there does not mean that the vaccine caused that.
And misinformation.
There is no test available that proves natural immunity or immunity equal to that of a vaccine.
About COVID-19, which led to a heated debate.
I'm furious and disgusted that this three-ring circus has been brought to this committee.
Then came a question about people dying from the vaccine.
It's like 15,000 people have died of the vaccine.
Are people dying from the vaccine?
People are not dying of the vaccine. We do not have patients in the hospital with vaccine adverse reactions. What we have in the hospital are people with COVID.
Lawmakers are worried people will lose their jobs if they refuse to get a shot that's mandated by their employer. The bill gives them an out with a variety of exemptions.
At the end of this month, she's going to lose her job, her insurance, and she's got asthma, and her doctor told her it probably would be not beneficial to her to take the COVID vaccine.
That's not appropriate medical advice.
You're telling people that their doctors don't know what they're talking about.
If that is what's being told to that patient by a physician or a healthcare provider, I have a problem with that.
Supporters of the vaccine exemption bill say someone's vaccine status should be private, while others argue it's not about privacy, but about the ability to contain the pandemic.
Our providers are fatigued. Our hospitals are full. Our sickest COVID patients are those overwhelmingly who are not vaccinated. House Bill 435 has the potential to exacerbate each of those truths.
To make this issue even more complicated, assuming lawmakers pass this bill, then on the federal level, OSHA steps in and rules employees must be vaccinated. That could make Ohio's law unenforceable. Maybe you still have questions or concerns about the COVID-19 vaccine. You're not alone. 10 TV's Tracy Townsend talked with a local medical expert who once said no to the vaccine, but now says yes, and says you should too.
Really tired and just drained.
Natasha Rose wasn't vaccinated when she got COVID-19, and she's a healthcare worker, a clinical nurse manager at Ohio Health Riverside.
The headache and the body aches were kind of awful. And then when I couldn't taste anything, I was like, oh my God, like this is real. This is what I just knew.
The wife and mother of 4 had to quarantine. Her husband got COVID too. Their kids were in the clear, but Natasha's position on vaccination, even with her employer's rule on vaccination, was not.
I wasn't in a rush to go get it. And then I had heard, you hear half a dozen of one, this or that. I mean, it's just like, I feel like if you're for it, you hear all the things to go get it. If you're against it, you hear all the things why you shouldn't go get it.
We really need to respectfully engage everybody and not really to have divisions between vaccinated and unvaccinated.
Ohio Health Infectious Disease Specialist Dr. Joseph Gastaldo was on the front lines of the pandemic from the start and worries now that far too many people don't have access to reliable information.
So really, unless you are really following this closely, which most people are not, it's very easy to go down a hole of misinformation and really have seeds of hesitancy.
The CDC and medical experts point to 3 widely available vaccines against COVID-19 that are safe, effective, and reduce your risk of severe illness. Getting the virus was a wake-up call, but Natasha Rose says finding answers versus misinformation was just as important.
I'm a healthcare professional and I'm not vaccinated. And so I just felt like I just needed my questions answered.
The state of Ohio is hoping more teenagers and young adults will get vaccinated this week. The portal opened for Ohioans' Vax to School program. Ohioans 12 to 25 years old can win a $10,000 scholarship or a grand prize $100,000 scholarship. 150 people will win the $10,000 scholarship and 5 will win the grand prizes. You have to enroll online. Go to 10tv.com for instructions. There is no deadline or drawing date for the winners at this time. The Ohio Department of Health added more information to the COVID-19 online dashboard. Vaccination rates are now broken down by age groups. You can also track how many Ohioans received booster shots. And the new daily case numbers now include reinfections. All of this as we are starting to see a decline in the number of cases. 10 TV's Lindsay Mills explains why doctors say that decline is no reason to let our guard down.
I think we're all hoping that indeed this is the last great wave.
Even though Dr. Bruce Vanderhoff from the Ohio Department of Health says it appears the Delta-driven wave has moved into a reclining phase, we need to stay vigilant.
As a doctor, I don't hang my hat too much on what I hope will be. I prefer to look at the evidence and the science.
And Dr. Vanderhoff says that science shows vaccines are effective in preventing severe outcomes of the illness. Severe outcomes like hospitalizations and deaths that doctors are seeing in unvaccinated pregnant women.
There is a 70% increased risk of death when you have COVID-19 and you're pregnant. And that number alone is just terrifying for those of us who take care of pregnant people in Ohio.
Which is why their call for pregnant women to get vaccinated is urgent.
In August, we had the highest number of women die from COVID because while they were pregnant, and that just should not happen in this country, in this world, in this time.
Dr. Lisa Egbert is the president of the Ohio Medical Association. She says to get through this pandemic, it's not just up to expecting moms. it's up to everyone eligible to get vaccinated.
While I would love for this to be the end, or, say sayonara to all of this, I think we need to recognize that we are at 70% as a nation, and we maybe need to be closer to 90% to have real protection from whatever is coming next.
If you need a driver's test, chances are it will be weeks before you can make an appointment. Still to come on Face the State, we look into the reasons behind the wait. Plus, hear from both sides of the abortion debate in Ohio as lawmakers take up the so-called trigger law. And welcome back. Abortion is a hot topic right now nationwide. This week, a federal judge halted the most restrictive abortion law in the U.S. Here in Ohio, lawmakers are discussing their own abortion bill. 10 TV's Richard Solomon has more from advocates on both sides discussing where the state stands.
It's a fight that some say won't end anytime soon. The fight for choice and the fight for life. And these two say they're in it for the long haul. Recent actions by the Biden administration ended a ban on abortion referrals at federally funded clinics. For Lauren Blauvelt Copeland, it's a huge victory.
Right to bodily autonomy, being able to make your own personal medical decision about continuing a pregnancy is vital. It's a human right.
Blauvelt Copeland is the Vice President of Government Affairs and Public Advocacy for Planned Parenthood of Ohio. They receive those funds. When the rule went into place under the Trump administration, it couldn't have happened at a worse time.
During the pandemic, access to reproductive health care like birth control and STI testing and treatment was less accessible because those through Title X weren't accessible to over 60% of Ohioans served through the Title X program.
But this isn't the only issue at stake. Right now in Ohio, Senate Bill 123 is on the table. The bill would trigger a ban on abortions in Ohio if the U.S. Supreme Court overturns Roe v. Wade. Allie Frazier with Ohio Right to Life says it could protect the lives of the unborn and the mother.
We don't believe that women need abortion. We believe that women deserve better than that, and we believe that it's time to end abortion in our state.
The bill has attracted much attention at the State House. This was just a day before the bill's first hearing. People who were pro-choice protesting the bill. A fight that won't end anytime soon. And these two determined to see it through.
We are committed to not just making abortion illegal, but making it unthinkable.
My human rights, my human dignity as a person to be able to make my own personal decision about continuing a pregnancy or not.
In Columbus, Richard Solomon, 10 TV News.
The next Senate committee hearing will be Senate Bill 123, and it could be discussed as early as October 19th. Well, when it comes to the crime of rape, survivors in Ohio are not permitted to bring their cases after 20 years. That's because of what's called a statute of limitations. One man is trying to change that. He was a survivor of rape at the hands of a church leader. But because he suppressed the crime for so many years, his case has never been heard before a jury. I spoke with him earlier this week.
I was supposed to hang out with the priest after church one day. During that service, he gave me an enormous amount of wine to drink.
Chris Graham's life was about to change forever because of what he says happened to him inside this church 24 years ago.
He raped me. And after the rape, he asked me if I wanted to perform the same act on him. I said no, and I ran.
Graham was 14 years old, and like most survivors, he says he erased it from his memory.
I can't remember ever thinking about it ever again.
But during the pandemic, he says the crime began to resurface in his mind. It was during several therapy sessions that he recalled how now deceased Reverend Raymond Lavelle did to him. The Roman Catholic Diocese admits he was credibly accused, but justice was too late for Chris Graham.
I had until I was 30 years old to come forward.
And you came forward at what age?
38.
In Ohio, civil cases involving children of rape expire after they reach 30 years old. In criminal cases, it's 20 years after the crime. In Graham's case, police investigated and found a woman to corroborate his crime thanks to memories he says came during those therapy sessions. She recalled, quote, seeing a young teen poorly dressed running out of the changing room, said the police report.
And she corroborated my story. She witnessed this man assault me in the social hall.
Now Graham is sharing his painful story with lawmakers in hope of changing Ohio law.
The gold standard is no statute of limitations. There are many states that have no statute of limitations on rape.
These are the 10 states where no statute of limitations exists for rape. Graham believes it's time for Ohio to follow.
I think there's an opportunity for our politicians to be heroes here. They could go out and save children's lives.
Graham is not alone in his pursuit of changing Ohio law. So are survivors of former OSU Dr. Richard Strauss. 300 people who Dr. Strauss hurt have lost the ability to sue because a judge ruled last month the statute of limitations had run out. Well, this week, the state announced the largest human trafficking bust in Ohio's history. More than 200 people were arrested. 10 missing kids were rescued. It was called Operation Ohio Knows. Crime Tracker 10 reporter Lacey Crisp tagged along as officers made the arrests.
More than 200 people were arrested statewide as a part of the human trafficking operation called Ohio Knows. One of those who was arrested is a Columbus firefighter. It starts with an ad, then a text or a call. It ends with the Johns in handcuffs.
Been going to therapy and that, but my wife and I mean, we haven't had sex in like 2 years. I've been going to Sexaholics Anonymous trying to get help, but too late, or just, I can't.
This man, who explains he's a plumber, has been arrested in the past for buying sex.
Of the arrests we've had so far, I believe 3 of them had prior arrest or warrants for solicitation.
The Central Ohio Human Trafficking Task Force made several arrests during the week-long operation called Ohio Knows. They asked all who were arrested to talk to a crisis intervention specialist who also works with the Hope Task Force. They wanted to learn why the men made the decision to buy sex.
And this is allowing us to kind of like take a step back and seeing what's causing these behaviors.
This man says he's an Uber driver.
Predators aren't necessarily the boogeyman. It just might be, your pharmacist, a council member, somebody who you might trust in the community.
In Westerville, police arrested a Catholic school teacher. The diocese said in a statement music teacher Randall Frazier was immediately suspended, then terminated. The Franklin County Sheriff's Office arrested 3 men who believed they were meeting a 15-year-old girl for sex. One arrived at a hardware store home service vehicle. 90 agencies statewide focused on Johns during the operation, the largest in the state's history.
And if there's no market, if there are no buyers, there will be no trafficking.
And Attorney General Dave Yost says he would like to create a public database for those who are arrested trying to buy sex. He says maybe a little public humiliation would be a good deterrent. In Columbus, Lacey Crisp, 10 TV News.
Just last month, Columbus City Council passed a new law to address human trafficking issues. City Council added higher fines and even jail time for those who are accused of buying or selling sex. That new law goes into effect at the end of the month. State lawmakers are looking at a bill that would help victims of human trafficking. Senate Bill 183 aims to help women who have been forced into prostitution against their will. The measure would allow these victims to have their part in past criminal records involving human trafficking erased. That helps them get a job, housing, or education. We'll keep you posted on the progress of that bill. If you've been to the BMV lately, you may have noticed it will take a few weeks to get a driver's exam scheduled. A viewer sent us a question about that issue. To verify wait times, 10 TV's Lindsay Mills took that question to the registrar.
After being closed for months at the beginning of the pandemic, the BMV faced a backlog for scheduling driver's exams. We recently heard from viewer Greg Chestet, who writes, driver exams in Ohio are scheduled out a month and some counties stopped offering them. When will each county go back to testing? The questions will verify for Greg. Is it true those exams are scheduled out a month? And have some places stopped offering them? Our sources, the Ohio BMV and Registrar Charlie Norman. According to a BMV spokesperson, the typical wait time for a test has always been around 3 weeks.
And that's sort of been the case for quite a while, irrespective of the pandemic.
You don't need to go to the station located in your county. You can go anywhere in the state to maximize your time and convenience. According to the BMV, there are only 3 driver exam stations out of 46 in the state that are temporarily closed. Officials say it's due to staffing issues.
BMV is not immune from the same labor shortages and staffing challenges that every other industry sector is experiencing right now.
So we can verify, yes, there is a wait time for driver's exams of about 3 weeks, and yes, some exam stations are temporarily closed.
And a new update is that we've switched to an online driver exam scheduling tool. You can find that at bmv.ohio.gov. It's quicker, much more convenient than calling in and waiting on the phone to speak with somebody to schedule a test.
Have something you'd like us to verify? Send us an email to verify@10tv.com. With your Verify, I'm Lindsay Mills.
There are 3 more members of the Ohio Civil Rights Hall of Fame. Hear what Congresswoman Joyce Beatty had to say about the induction of her late husband. Governor Mike DeWine spent a couple of days in Texas this week. See what he was doing there with 10 other GOP governors. We'll be right back. And welcome back. Early voting is now underway in Ohio. Secretary of State Frank LaRose says this is an election you need to pay attention to.
There's important issues on the ballot coming up this November, including school board races. Right here in Central Ohio, there's a congressional race. A lot of things that really matter for your community.
Let's take a closer look at some of the issues on the ballot involving schools. Reynoldsburg is asking voters to approve a bond issue that would build a replacement for the district's 153-year-old Hannah Ashton Middle School. Madison Plains Local Schools has a levy back on the ballot after it failed in the May primary. Coshocton County Career Center has a levy on the ballot that would allow money to be used to help build a new career center after the state funding was frozen in 2019. This week, you can vote early in person Tuesday through Friday, starting at 8 in the morning. You can also send in an absentee ballot. You can find your voting location online. We have a link at 10tv.com/featured links. Dayton Mayor Nan Whaley now has the support of the Baptist Ministerial Alliance of Columbus. Whaley is one of several people campaigning to be Ohio's next governor. The Baptist Ministerial Alliance of Columbus endorsed Whaley, saying she will, quote, strive to ensure that every family in Ohio has the opportunity to succeed and live up to their God-given potential, end quote. John Cranley is another Democrat who's running for governor. On the Republican side, Governor Mike DeWine is running for re-election. He's up against Central Ohio farmer and business owner Joe Blystone and former U.S. Congressman and former U.S. Senate candidate Jim Renacci. Ohio Governor Mike DeWine spent time this week in Texas. He met with the National Guard, who've been deployed for nearly a year there.
Saying to all the families of the members of the National Guard who might be watching this, thank you. It's been a long year, I'm sure, for you. But we appreciate your sacrifice. We appreciate the men and women who are down here making a difference at the southern border.
Currently, there are 113 Ohio National Guard members in Texas. DeWine was just one of 11 GOP governors to visit the U.S.-Mexico border this week. They wanted to draw attention to what they call a, quote, crisis at the border. This follows their calls for a meeting with President Biden about border issues and the recent influx of migrants trying to cross in to the United States. Well, 3 new inductees are now into the Ohio Civil Rights Hall of Fame. Our Tracy Townsend was the mistress of ceremonies for the induction this week. Columbus inventor Granville T. Woods, Dayton activist W.S. McIntosh, and former Representative Otto Beatty Jr. were all inducted posthumously. Congresswoman Joyce Beatty accepted the honor on behalf of her late husband.
These are Ohio giants, and so we must continue to be in the fight. In the fight for every one of these Hall of Fame recipients, my dear Otto would say, continue to fight for the right to vote.
Beatty went on to call on Congress to pass the John R. Lewis Voting Rights Act. Today's induction was the 12th annual ceremony. Thank you all for being here with us today. And remember, if it affects you, your family, and Ohio, we're here to make sure those accountable face the state.